Yeah, I'm good, thank you. My daughters are next door. I try to get them, but they're so busy with what they're doing. Hi.
Oh, God. And my daughter's my Oh, how are you,
so
Nandipha?
sweet. Hello. Nice to finally meet you.
So, thank you for joining us today, Nandipha. I really appreciate it. So, Dr. Dr. Nandipha Makuduba, thank you for taking out of your day, your hectic day of the kids and working and hustling today. So, yeah, he's off me out. So he's going to. Thank you for joining me today. And, you've come such a long way. You're now the founder of the Optimum Medical Group, as well as Aurum Holdings. You come from a small village called Bizana in the Eastern Cape, and then you grew up in Port Edward, and then now you find yourself here in Johannesburg with a beautiful aesthetic clinic. But all through, like reading through your bio, all through high school and through medical school, you had a sense of like giving and wanting to learn more, and interest in medicine, interest in children, interest in women's rights as well. And it's just amazing to, know, while you were still a high school student, you helped out at the pharmacy. While you were studying medicine, you were also working at a pharmacy as well. So just very hardworking and very determined. So it's so nice that you reached so far. Guys, okay, thank you. We will see you. We'll see you after the hour. Okay, bye.
They're welcome to come in. I'm sure they've got a lot to share.
I think they're just trying to grapple with each other there. She's a good big sister, though. Thank you for joining us today, Nandipha.
Thank you.
We were chatting the one day, and we were talking about all the different kinds of things we mainly see in our different practices. And you mentioned, you see a lot of skin issues, and one of them being acne. You're seeing an increase in adults also presenting to your practice with acne. And for all the patients that are listening, how would you describe acne? Like, what would you say acne is?
Dr. Njana, you're absolutely right when you're saying, acne is one of the most common skin diseases that we actually see at Optimum. And there's a high rise of adult acne because historically people thought acne was just a disease that affects mostly teenagers due to the hormones. Yes. But we live in a different space and time and era where we are seeing a lot of adult acne presenting, and purely because and with the presentation we're seeing more women as opposed to men presenting with adult acne, and one of the contributing factors, one of the reasons is due to stress. Can you believe? So and the reason is because women are under high intensive stress levels, and the reason is because they are working in their careers from their day-to-day jobs. They have those demands. They also have the demands of sustaining and maintaining a household. So all of that, can you imagine, together with everything else that a woman has to do on her daily basis, besides her career, her work, her family, everything, it leads to a lot of stress. It leads to a lot of hormones being released. And picture that environment. That's just the ground of producing acne. And so I think that is why we're seeing more women and we're seeing more adults presenting with acne. Yeah, and it's due to stress.
So that's one of the big reasons, stress, genetic, and also, it's controversial, but diet. Do you believe diet also plays a role in...
Controversial. I love the word you used, that is controversial. And it is. It is, and especially in the dermatology society, I think because, as you know, Anjana, how we practice as medical professionals, it's all based on evidence, right? Evidence-based medicine is what leads us, and that's what directs us. And because of the lack of evidence there is with regards to diet, it's difficult to actually pin it and say, yes, it is one of the reasons that causes. I mean, I know of only 2 literature studies and reviews that actually tackled that. And prior to that, it was a very controversial topic and subject when it comes to diet. So I think it's one of those things where, I mean, you'll read up other sources of information telling you and alluding to the fact that diet does cause acne. But we have to work with evidence. So we need a little bit more evidence so that we can pin it on that and we can stand behind it and we can say, yes, and these are the reasons because of that. So,
and then also, carry on. I was going to. Oh, okay. So, am I going? I'm going. Well, we know, but like for people out there, they often confuse. They'll call rosacea adult acne. So, how can people out there differentiate between, if they've got acne or like adult acne, or do they have rosacea? What would they have to look out for?
Okay, so with rosacea and acne, it's a case of mistaken identity when it comes to those different, disease profiles, purely because they look similar to each other. So the one way that you can differentiate is basically you can look at the areas that it affects. That could give you an idea what you could possibly be dealing with, as well as the symptoms, and also you treat it differently. So basically with rosacea, you look at the central region of the face. That's where it actually presents, and usually around the nose and the cheeks, and it presents with red bumps, whereas with acne, you're going to see blackheads. So, So with acne, you can see that it presents itself beyond just the face. You will see it on the chest. You will see it on the shoulders. You will see it on the back. And also how it also presents is that you will notice blackheads on any of the pimples or papules that you are seeing.
Okay, that's interesting, because we're going to talk about the areas that you mentioned, and then the different grades of acne. So in those areas, there's a unit, a little subunit of the skin called the pilosebaceous unit, where with the hair, the sebum, and if you go through a little bit of that. So in those areas, that's where you get quite a bit of acne. And then again, you mentioned blackheads or comedones. So there's blackheads, there's whiteheads, there's pustules, papules, so they're all different grades. So, I'll ask you the other question, because I was going to ask you.
No, it's okay. We can just continue and just make it, we'll continue. So you're absolutely right. So acne is a disorder of the pilosebaceous unit. So to describe the unit and what it is, basically it consists of a hair shaft. It consists of follicles, as well as the sebaceous gland, and then there's this erector pili muscle, which helps everything stand. So it's an inflammation process that happens around that unit. So what happens is that you've got all these pilosebaceous units all over the body, except on the palms of your hands. You don't have it there. You don't have it on the soles of your feet, as well as around your lower lip. And just around here, you don't find it. You don't find that unit there. So basically, what it is that you've got sebaceous glands that produce sebum, and with this sebum, I'm just gonna try and be very. I'll speak in a non-medical term, just so everybody could just understand. So you've got this sebum that is produced. It's like an oily substance, like lipids, as we may call it, that is produced on your skin. And what happens is that you also have bacteria that lives on your skin, which is called Propionibacterium. I hope I'm saying it right. It lives here, and as the sebum is produced, you find that inflammation process actually takes place. And with that inflammation, you've got these white blood cells that actually come and they will produce enzymes that will damage the follicles, and then you get all of this, pus being released. So initially, what you have, as I said, those white blood cells will release that enzyme, and this inflammatory reaction that takes place will cause this little red bump. That little red bump, we actually call it a papule, and then which can actually develop into a pus-filled blister, and that pus-filled blister, we actually call it a pustule. Say hello. I have my daughter who just say hello, Azzy.
Hello. How are you? Hi. How are you? You just like getting each other.
So this bacteria, right, called the Propionibacterium, it actually uses the sebum, that nutrient, as its growth nutrient, to actually grow and to actually spread and to cause that inflammatory process. And then that's how you develop those bumps and those pustules. And then in severe cases, that's when you will develop cysts. So I hope that explained.
Yes. And now, in terms of this bacteria, so it's normal. It's normal that it's on our skin. It's just when things are out of balance that it starts acting up. It's overactive. And then I know the sebum. The sebum is really important for maintaining our mental to be acidic. And then you mentioned the white blood cells, so making all that pus. And as you said, it releases enzymes. So, a lot of the things that affect us and a lot of the things that you see, like the post-inflammatory hyperpigmentation, I know you see a lot of melasma, and then from the acne and all those white blood cells, they release those, they're like protein-eating enzymes. So they eat out our collagen. I know that's not the very scientific way of saying it, but then they, people get those pop marks. Those pop mark scars. So, the earlier the better. And, we're talking about adult acne and early onset, or acne that, I don't know how to say, that it carries on now. I had the word persistent. It's persistent acne. And, I know you tell your patients they probably have, it's ongoing treatment. And like you mentioned also, it's a chronic disorder. So, and in this time now of lockdown, people would come to you for treatment. You can mention, if you don't mind going through what you do for them at the practice, if they present, and then when to refer them, which stage would you refer on in terms of other management. And then, now importantly, a lot of people still can't go out. What can they do at home? Because I know, the practices are delivering things like what sort of things can they do at home as well?
Can do. Okay, so let's say we've got a patient that presents to us and they're presenting with acne. First and foremost, the first things that we do is we take a thorough medical history, and we ensure that we know exactly what could possibly be the triggers or the cause of the acne, because sometimes you may treat symptoms, but if you don't go into the underlying history of the patient and know exactly the possible cause of it, you may miss it. I'll make an example. If a patient comes and they possibly have a genetic history of acne, and if you miss that and you miss asking those relevant questions that could actually lead you finding out their medical history, it could be it's a patient who's presenting with PCOS, maybe, and that is the cause of the acne.
Yes.
And meanwhile, you are continuously treating the symptoms but not getting into the endocrine problem, and the PCOS problem causing the acne. Therefore, that patient is needed to be referred to see an endocrinologist. So you don't work in isolation. You work together in collaboration with many other doctors and specialists and health professionals within, your field, so that you can give the best outcome for the patient. So also understanding the person's lifestyle, understanding their stress levels, where they are and where they're working, their home environment, that could actually allude to you actually pinpointing maybe it's possibly due to stress, as well as just finding out the area that they live in, maybe finding out their product history. We do a thorough product history, because they could be using inappropriate products on their skin, which could be causing, an allergic reaction. It's also very important to know whether it's a reaction or it's actually you dealing with acne. And lastly, just finding out any issues in terms of like hormones. I know a lot of professionals, when they see a female, sorry, I just read from Tabby. She's asking, is diet important when you suffer from acne? Yes. Tabby, I don't know if you just joined us or you were here before. We did touch on diet, but I'm going to let it go back to Dr. Njana so that she could just explain where we were with regards to diet. Just so as I was saying,
yes.
So as I was saying with regards to hormones, as I said, a lot of times because it's females that present, and it's okay, Tabby, we're gonna go back to it, don't worry.
Yes.
So as I was saying that with hormones, a lot of professionals will put their patients on oral contraceptives, and particularly because women present, and they the gender that actually presents the most. So you find that they get put on oral contraceptives, but not looking into, for example, the other factors that could actually be causing the acne, which is, like I said, one of the biggest problems is stress. And the reason is because the stress will then increase your cortisol levels as well as your hormonal levels, and then that producing, more oil and more sebum and creating that inflammatory cascade and process. So it's very important to know that, there's layers in treating a patient. You may be dealing with the hormones, but what's actually triggering the hormones? The stress.
Yes. And that's very common now, while everyone is at home, stress. And, I think everyone's doing a bit of virtual advice and virtual consults. And that's what we all, I think, seeing quite a bit of is people presenting with that. And then Tabi asked about diet. So we went over it. Tabi, it's a very controversial subject, as dairy and carbs and all of that exacerbate or make acne worse. So there's no scientific proof really to say, yes, it does. No, it doesn't. Hello, Dee. So there's no scientific proof. So we can't say yes or no. I mean, people propose that, maybe you having, say, dairy, like milk from a cow, and the cow's full of antibiotics and hormones, and that might affect you, but there's no real scientific evidence of that. Yeah.
Absolutely, and right.
I asked along the way, I'm so sorry we didn't get to it when you asked, but they asked, are cheaper products not as good as expensive products when it comes to treatment? But I mean, you can get like a really, I suppose it's not a medical device, so I can mention the brand. I hope they don't come after me, but they like say Estee Lauder or Lama or something like that, or La Prairie. Super expensive brands, but when they do these comparisons and studies, they're not any more effective than a proper, maybe well-priced medical grade or cosmeceutical brand. I don't know what, and I mean, that you might even get some brands at pharmacy, like Cetaphil and all of that, that might be useful. What do you think, Nandipha? Like, does it have to be expensive? Yeah.
Oh, hi, am I back? Are you seeing me?
Yes, now it just went a bit, yeah, but now I see you.
Okay.
And here's Eucerin as well. If you can,
we had a little bit of a pause.
Yes.
So as I was saying, a very important conversation and a very important topic, especially when it comes to products and over-the-counter products, our products, drugstore products, all these different products that are out there. So this is my opinion when it comes to products and treating. There are many products in the market, many. And there are many different products in terms of prices that are out there. Mm-hmm. So we need to, as a community, especially when it comes to skincare and taking care of ourselves, we need to get to a point where we understand active ingredients. You see, that's when people will understand whether a product is good or it's not good, not based on price, but based on the active ingredient that is in the product. What does that mean? I'll give you an example. That means there can be a product that is on the aisle, let's say at a local pharmacy, a drugstore, but because it contains that active ingredients that we do like when we treat acne, for example, benzoyl peroxide, one of the active ingredients that we use. Do you know what I mean? It could be on the aisle, but you have an advantage of knowing that that actually treats acne. Do you know what I mean? As opposed to buying a product based on a marketing, brand or anything. I mean, it all depends on different pockets. There are brands out there that are so good at marketing and placing themselves out there that people think these are good products. So we need to really empower ourselves, and we need to empower our patients. We need to empower our people as to understand, when do I purchase a product? When do I not purchase a product? What kind of product do I purchase? What active ingredients are in the products for me to actually make that decision? Once they understand that language, that term, then it's easier for them to make informed decisions on buying our products based on the type of ingredients that are in the product, as opposed to just buying a product because my friend who lives down the street from me uses a particular product because it's well marketed and everybody identifies with this product, but actually I don't even know what's in the product.
Yes.
So, yeah. So it comes with education.
True. Yeah. And there's so many questions coming in now. I saw the first part, but when do doctors prescribe antibiotics? So when it's at the pustular stage, but you can, when would you prescribe the antibiotic? Yeah.
So I always say for mild acne, I wouldn't necessarily put you on an antibiotic. Mm-hmm. We can treat topically. We don't have to treat orally. So when I get to the oral stage, as you said, it's because of the pus that I'm seeing, and we're really trying to just get rid of that. Mm-hmm. Also, on the severe stage, which is the cystic stage, I would also put on antibiotics on that stage as well. But while it's still mild, we'll do the topical treatments. We'll do home care treatments. I'll let you come in for chemical peels, also depending on how you're presenting and what you're presenting with. And there are various chemical peels that we offer that are for acne. For example, one of the chemical peels that we do offer contains salicylic acid, which really helps with opening up, the pores and taking out, that dirt and debris that's collecting and causing those dead skin cells. That same chemical peel also contains glycolic acid, which is really, really great for hyperpigmentation, because remember with acne, it also causes post-inflammatory hyperpigmentation at the same time, but in a conservative and mild way, because as you know, in our practice, we deal mostly with type 5 and 6 skin, which is darker pigmented skin. And that skin is most likely very, very, high at risk of getting post-inflammatory hyperpigmentation. So therefore, when we are using topical products as well as some of the chemical peels that we do choose, we need to work at a very conservative level. We'd rather, and a superficial level as well, we'd rather keep bringing you back in as opposed to being very aggressive, because you are at risk of getting post-inflammatory hyperpigmentation.
Mommy. And just to address Tabi again, about the product. So Nandipha was talking about chemical peels, but, I think you guys have probably heard me say this in almost every live about, if you're not prepped, it's like if you're not prepped, like exercise-wise, and then you go do a chemical peel, it's just like me, which I hate running. You're a runner, but just going to go run a marathon. And, Nandipha's talking about salicylic acid. So it's not a Mickey Mouse little acid. It's got like a really small molecule. It dissolves through lipids, that she was talking about, that is produces acne. So it's nice to prepare your skin with maybe beforehand, a few weeks before you get, we've got a very popular, like a wash, like a salicylic acid wash. It has a gentle sort of glycolic acid, and a lot of them also have a combo of lactic acid, which is also a nice glycolic acid that helps with moisture. So, another misconception is, my skin is oily, I have to not moisturize, I have to be dry. And that's not the case. It's not to scrub your acne away. And then, again, Tabi was saying about her product. So, it's not only the product, and it's not only you, the doctor or the peel, but it's also what the patient is doing at home, using the products correctly, the PIH, getting a nice oil-free, mineral-based sunscreen. So a lot of the work is also done at home, And Nandipha is on pause, which is wait. I think there's a lot of internet activity nowadays while everyone is at home. But please keep the questions coming while Nandipha's on pause. Someone says, please save. I will save it. So at the end, it saves and it goes straight to IGTV. What then? So we just mentioned Sunshine Violet Heart. By starting, I think Nandipha is going to join us again. So Nandipha is probably going to come back on. So when your skin cleared after antibiotics and a routine that was proposed by starting again. So as we mentioned, acne is a chronic condition, so it needs consistent management. So you might, like some people, even the isotretinoin, which I'm going to ask her about, some people have to go on more than one course. And collagen, there are some good studies on collagen and your skin. It is also a very controversial subject, but we have personally seen also improvements in our patients' skin, also leaky gut. So gut inflammation also is a contributing factor to inflammation on the skin. So it can improve that way. And if anyone's intermittent fasting, it's nice to have a collagen sup before you break your fast. Sorry, Nandipha, someone asked, are you on pause or are you still on pause? So Nandipha, someone asked about how does taking collagen supplements help your skin as well as reoccurrence of the acne after a year? I think what I'm going to do, Nandipha, is I am going to, what would you suggest for an oily T-zone? I am going to log Nandipha off and then I'm going to log her back in. Is that okay, Nandipha? if I log you off and log you back in. What would you suggest for an oily T-zone? We'll address that now. Can you hear me? Are you? It's in super slow motion. There we go. It's going faster, but it's in super slow motion. Let me try something. There we go. Looks like you're moving normally.
Thank you.
Yay!
I think it is my internet. It was down for a second, and we just tried to sort it out. But I hope this could just carry us through.
Extreme slow motion for a bit. But someone asks,
yeah.
You know, there were 2 questions on collagen supplementation. And then there was one, the oily T-zone. So what are your on collagen supplementation and how beautiful it makes your skin look? And if it does,
definitely, I recommend collagen to my clients. Almost everyone. Okay, so everyone that comes into my practice is put on collagen. Everyone is put on vitamin C, and I'll give you reasons why. Purely because collagen, it's the proteins of the skin. It makes the skin matrix. And when I assess somebody's skin, I always look at their skin integrity. And most often you'll see that some people's skin integrity is really poor, purely because they're not taking in enough collagen. And I mean, as you know, our diets lack so much. Supplementing with something as great as collagen is just going to give you the added extra benefit of getting a nice, beautiful, you know, skin integrity as well as glow. The reason why I also put everyone on vitamin C, and it's really amazing for skin, and not only is it great for skin, it's actually great for your immune system, and particularly right now with our COVID situation, it will help. So vitamin C is a great antioxidant. And what it does is that it helps brighten up the skin. And not only does it help brighten up the skin, especially because I see a lot of hyperpigmentation clients, it also stimulates collagen. So they work actually hand in hand. Or a lot of people have seen a lot of, you know, marketing and everything out there with regards to collagen intake and the benefits of collagen. I just say,
I'm not sure, Diamond. I know Nandipha's internet is conking out a little bit. Any specific collagen brands? So I'm not sure if we're allowed to mention brands, but so, you know, there's bovine, there's porcine, which is pork derived, and there is marine collagen. A lot of it also depends on your cultural and religious belief, where you came from, what you've built, and the challenges you're facing now. What can you say to us?
Okay, so I heard you, Dr. Njana, and thank you. I hope everyone can hear me. Basically, I think what she's asking me is with regards to the business and aesthetic business and where we are right now, especially with what we're faced with. We're currently in a pandemic, in a crisis, and I would say that as much as this is what's happening to us and to everybody else around the world, this is the time to actually, you know, a crisis can actually breed new opportunities. If we take some time and look at the positives that could actually come out of a crisis of this nature, as opposed to crying each day and saying, oh my goodness, my practice is closed. I'm not seeing my clients. Do you know what I mean? I'm not seeing anybody. Work is just on a standstill. There's a lot that you can do. You can actually get yourself into starting, signing yourself up with webinars You can upskill yourself. This is an opportunity because we're under so much pressure on a daily basis in running the practice and seeing our clients and seeing everyone, and coming home and also sorting our families, that we are clinicians at the end of the day. We're not just running a business, working, we're also still doctors and clinicians. Therefore, that requires a lot of learning and studying and continuing that work. This is the perfect opportunity and time to actually gain more knowledge within our field. And also doing a lot of collaboration work with other doctors as well, just like what we're doing right now, Dr. Njana. This is excellent. If you are capable to start an online talk conversation with any of your colleagues, as well as even talking to patients, I think that's also very important. Get to understand their perspective of what of some of these conditions, as well as treatments that we do on a daily basis. See it from another point of view and another side that could actually help. Because all in all, we are trying to facilitate conversations. We're trying to continue the conversations. And with these conversations, this can help somebody else. It can help another clinician. It can help another patient. It can help so many different people. And we need to be doing that. Also, thinking outside the box. So
Yes.
as much as you are in this industry, what else can you do besides what you do on a daily basis that could actually help maintain and sustain your business? This is the time where we really, really have to be very, very innovative, and we really, really have to, work towards making sure that we come out of this pandemic alive.
No.
Our
Alive
business, ourselves, everybody needs to come out of this alive.
Thanks so much for that, Nandipha. So many questions were coming through. We are going to save this, and there were lots of questions, so we will save it. We are, it's under like an IGTV. So please ask as many questions as you would like. And we thank you guys. Hello, Salona. And hello for everyone. Hello, and we really appreciate it. And we're glad that there were some nice comments about learning a lot. We obviously love talking and love teaching and love informing patients. And thank you so much, Nandipha. It's so nice to see you again in person. I actually love these lives because I get to see you.
Yes, I love that as well. And I just want to thank everyone for coming in today and actually taking their hour of their time and listening through, and also for the comments and the questions that were coming through. Really, they were great questions. And if we can, we'll be able to answer some of those questions. I think you said you're going to put it up on IGTV.
So as soon as it ends, it automatically goes to me.
Perfect.
And Pete, so any questions you want to direct to myself or Dr. Nandipha, please do so. We love answering your questions, as you can see. Thank you, Nandipha.
Thank you for having me.
1 and type 2, and it also depends on the amount you take. So at least 10,000 milligrams a day. But yeah, there are some popular brands. There is the Super Collagen C from iSkin that our patients like very much. Proactive is also a popular brand. Uvidome as a brand. I think it's called collagen peptides. So there are some popular brands out there. Oh, Nutritia is another one that I know of. It's just that you must get, it's proper pure collagen, peptan, one which is bovine. Just make sure that the source is reputable and at least 10,000 milligrams a day. Suggest for an oily T-zone. So the same. So in terms of, it's to get your barrier function correct in what you're using at home. So we often, this is us at our practice, we often advocate an acid-based sort of soap-free cleanser, something with salicylic acid, or if you're able to, glycolic acid, if you've got a bit of a sensitive skin, like a creamy acid, but no soap, because soap is alkaline, it can strip the acid mantle, and just cleansing. I'll get to you, Diamond Day. So, the proper cleanser first, and then a hyaluronic acid-based cream that is, water-based, so it doesn't make your skin oily, and nothing with vitamin E in it. We've got a really nice, you get some nice antioxidants that you can also use that are non-irritating on the skin, and an oil-free cleanser. So not to also leave your skin, parched at night. So you must moisturize at night. And if you can use a retinol or retinaldehyde, or an alternative at night, if you find either of them irritating, to renew the skin. Retinol also sort of matures the sebaceous gland, so that it reduces the amount of oil that's produced. It also helps with the post-inflammatory hyperpigmentation. What do you recommend to treat both? Lindy, have dry skin and I can see it getting lines. Don't be sad, Lindy. There are things you can do, and also have hyperpigmentation. So the main cause of those two things is photo damage or light damage. Not only the sun, but mainly the sun. So a good sunscreen, and then you'd have to repeat the use of the sunscreen every 2 hours, or if you can't, there's even makeup that has sunscreen in it. It's called Color Science. It's like a mineral powder. And in terms of the lines, depends what kind of lines there are. So you can do, you can have a collagen sup. You can think of using a retinol or retinaldehyde at night. Changing your I think Nadipa's internet is not great, and we're going to, we're also going to ask her about business and business struggles, which would have been great. But maybe we'll have her on again, and then. So just getting back to the lines and the hyperpigmentation. So sort of retinol-based product works well. Again, Nandipha mentioned the vitamin C. That's also very good as an antioxidant for hyperpigmentation. So hyperpigmentation, as well as protecting against the photo damage, the high energy visible light that we're exposed to now inside with our phone, Zoom, the TV. And a good sunscreen treatment-wise, there's lots of treatments that are available. There's microneedling, there's PRP, there's moisturizing lactic acid-based chemical peels that you can use, or if your skin is prepared, there's Restylane skin boosters. There we go. Deeper. There we go. What is good to use for hyperpigmentation? Firstly, a good sunscreen that is mineral-based, vitamin C, retinol, some tyrosinase inhibitors such as kojic acid, arbutin.
Yes, I'm okay. I had to even move places around the house so I can actually use the mobile data and get off the Wi-Fi, because I think our Wi-Fi was down.
Oh, okay. Oh, no. One of the questions was, we did answer it briefly, was the oily T-zone. And then what is used for hyperpigmentation? There's so many things. It's a big question.
So with hyperpigmentation, are we talking about products, or are we looking at the different treatments that we offer?
Well, it's a very broad question. So
yeah,
I suppose maybe a quick combo on what you would like actives that would be sunscreen preference, and then what kind of treatment you could do for them at the practice.
So at the practice for hyperpigmentation, there's a variety of treatments that we do. But we start you off, as I said, it's a stage-step process that we do. And we'll start you off, for example, with a chemical peel. And depending on the severity of the hyperpigmentation, we have a peel that has a combination of different actives. That is glycolic acid, salicylic acid with lactic acid. That is more of like a milder hyperpigmentation. And just to take it a step higher, for that resistant hyperpigmentation, almost going to melasma, we will then add a tyrosinase inhibitor in the treatment. So with that, things like your tranexamic acid, that will help with that hyperpigmentation. Remember, with hyperpigmentation, it's increased melanin, so you try look for tyrosinase inhibitors, because tyrosinase is the enzyme that actually produces melanin. So you look for any of those ingredients that will actually help stop that process, like almost reverse it. We prefer using also natural tyrosinase inhibitors as opposed to chemicals, harsh chemicals like your hydroquinone. We don't use hydroquinone in our practice, even in small percentages, purely because of its history and its effects with regards to how your skin reacts to it, especially darker skin. So I try to stay away from any of those chemicals. I know a lot of doctors do use to treat hyperpigmentation in small quantities. So it's each their own way of how to deal with hyperpigmentation.
So, is also not really using hydroquinone. People get addicted to it and they abuse it, even though it is an effective agent. But you can't use it forever, especially in a climate like this. And you're right. There's so many different peels and even injectable treatments that you can do to help hyperpigmentation. And then it ties in one of the questions someone just asked. It's not banned. It's not actually banned here.
It's not banned.
Not banned.
I think
but someone asked.
It's Diamond Day SA. So Diamond Day SA, when they say it's banned for over-the-counter use. So if I'm walking in the streets and I go into a shop and I just buy hydroquinone, I can't. That's not the way that it should be sold. It's a prescription medication. So, for example, health professionals have access in prescribing it to someone should they need to use it to anybody. But as a person who's just going to the pharmacy or just going to the shops and finding hydroquinone, that's the banned part of it. I think I don't know if that makes sense.
Yes. So someone asked, and I'm going to also to Tabile. Yes, but someone asked me to use my own facial products at home when having a peel. I would say no.
Thank you. Thank you. No, Tabi, no. You know why?
Sorry, she asked me.
And it actually contains a retinol. And I don't know, and you need to stop using retinoids just before you come for treatment. So then you've got too many active ingredients working on you, and that's going to be a problem, and that's what's actually going to cause your post-inflammatory hyperpigmentation. So please give me everything that you have so I can see it.
And also, I think, what I've seen is that this on both sides.
Okay.
So, people, and you see, I mean, we also guilty of using that hashtag glow getter and whatever. People think it's one peel, it's a quick fix, and they're going to glow. I even had someone, you come in and you ask the patient, how can I help you? What brings you to see me? It's like, I want to glow. That is the be all and end all. And there's so much work that goes into, like a Britney song, if you want water, you got to work for it. And it's not like that simple to just get that glow. It's a lot of hard work, and everyone thinks peels and this is the only answer, but it's not. It's just part of the answer. Yeah. Don't worry, Rosie. I hope we're back online. Rosie says the network is back. It is bad. And someone asked, will vitamin C make my skin oily? It depends on the type of serum that is used and what's in the serum with vitamin C. If you're prone to oily skin and breaking out, maybe not to use it in combination with popular with our patients. If they are prone to acne and if they also have a bit of hyperpigmentation, it's in combination with something called floritin, which is derived from apples actually, and ferulic acid, which is also an antioxidant, and vitamin C. So you find that, hello, you find that that helps a lot. So, and then there's another one in the same range that's vitamin C, vitamin E, and ferulic acid for more mature skin that might be a bit dry. There's a lot of questions coming in to help post-lockdown. Would you say glow starts from within? Could it be good that we are, we were just talking about the diet and in terms of acne, but yes, it does. So there's lots of factors I think that goes into it. There's even something called ages and glycation products. So basically what's happening is that eating a lot of sugar, and it's just a simple way of putting it, but because of that sugar, you are breaking down your collagen, and that is damaging your skin. So I think it does matter what you are eating and what you're taking in, as well as what you're putting on your skin. Yes, I also want to glow, but my acne can't allow me. So, Rhoda, it is a long road, but you can get there. It's just consistent use of the correct active products at home, as well as coming in for appropriate and safe treatment. So the only thing is consistency and patience. I have an issue with blemishes and I need a good remedy. The same. So the basics, guys. So, and someone's asking about Regime A. When I was a teenager or still on campus, we'd use Regime A. It's a very good South African brand. My favorite from there would be the Scaripe and Quantum Molestin. And then Nandipha is, yes, it does matter. She agrees with the sugar issue. While Nandipha is logging on, so people are asking about blemishes, about acne, a lot of questions about hyperpigmentation. Let's see the best I can get over the line. Since it's locked down, actually, from most of the asking about potential skincare. So you can especially with essential service based clinic, they do send out the basics routine. So like proper actives, safe, appropriate for your skin, good sunscreen, consistent treatment coming in for your treatment. Listening to the post-treatment instructions. And there are a few minutes before we time out. So we've been going for probably an hour. I know there's something that flashes.
Hour goes so quick.
Yeah. Oh, wow. But before we end, also, there's questions about this thing. But also, Nandipha, there is something I want to ask you, because you always talk about business and business struggles, and in this difficult time, before we time out, if you can just leave us with a positive message, because we chat about where we've come from, humble beginnings and all of that, to where you are now. They said my line is now very bad. Okay, but if Nandipha, if you can hear me, if you can end off with something positive and something that can motivate people, because thinking of where you came from, what you've built, and the challenges you're facing now. What can you say to us?
So I heard you, Dr. Njana, and thank you. I hope everyone can hear me. Basically, I think what she's asking me is with regards to the business and aesthetic business and where we are right now, especially with what we're faced with. We're currently in a pandemic, in a crisis, and I would say that as much as this is what's happening to us and to everybody else around the world, this is the time to actually, a crisis can actually breed new opportunities. If we take some time and look at the positives that could actually come out of a crisis of this nature, as opposed to crying each day and saying, oh my goodness, my practice is closed. I'm not seeing my clients. Do you know what I mean? I'm not seeing anybody. Work is just on a standstill. There's a lot that you can do. You can actually get yourself into starting, signing yourself up with webinars. You can upskill yourself. This is an opportunity because we're under so much pressure on a daily basis in running the practice and seeing our clients and seeing everyone, and coming home and also sorting our families, that we are clinicians at the end of the day. We're not just running a business, working. We're also still doctors and clinicians. Therefore, that requires a lot of learning and studying and continuing that work. This is the perfect opportunity in time to actually gain more knowledge within our field. And also doing a lot of collaboration work with other doctors as well, just like what we're doing right now, Dr. Njana. This is excellent. If you are capable to start an online talk conversation with any of your colleagues, as well as even talking to patients, I think that's also very important. Get to understand their perspective of what are some of these, conditions, as well as, treatments that we do on a daily basis. See it from another point of view and another side that could actually help. Because all in all, we are trying to facilitate conversations. We're trying to continue the conversations. And with these conversations, this can help somebody else. It can help another clinician. It can help another patient. It can help so many different people. And we need to be doing that. Also, thinking outside the box. So yes. as much as you are in this industry, what else can you do besides what you do on a daily basis that could actually help maintain and sustain your business? This is the time where we really, really have to be very, very innovative, and we really, really have to, work towards making sure that we come out of this pandemic alive. Our alive, and ourselves, everybody needs to come out of this alive.
Thanks so much for that, Nandipha. So many questions are coming through. We are going to save this, and there were lots of questions, so please save it. We are, you can, it's under like an IGTV. So please ask as many questions as you would like. And we thank you guys. Hello, Salona. And hello for everyone. Hello, and we really appreciate it. And we're glad that there were some nice comments about learning a lot. We obviously love talking and love teaching and love informing patients. And thank you so much, Nandipha. It's so nice to see you again in person. I actually love these lives because I get to see you.
Yes, I love that as well. And I just want to thank everyone for coming in today and actually taking their hour of their time and listening through, and also for the comments and the questions that were coming through. Really, they were great questions. And if we can, we'll be able to answer some of those questions. I think you said you're going to put it up on IGTV.
So as soon as it ends, it automatically goes.
Perfect. And
so any questions you want to direct to myself or Dr. Nandipha, please do so. We love answering your questions, as you can see. Thank you, Nandipha.
Thank you for having me.